Knee pain is one of the most common complaints that we see. Just the other day, I saw a guy who had a lot of knee pain just on one side when doing lunges. Now, knee pain is common with squats and lunges, especially with lunges because in the lunge position, you have all of your weight or most of your weight on one side and you don't have the side to side stability that you do when you do a squat. When we looked at his technique, you could see that on the painful side, the knee would move in a little bit compared to the non-painful side where the knee would stay out. Now, this position is called valgus of the knee. Most commonly, this can either be an issue with technique, or it can be weakness of the hip muscles, or it could be tightness of the ankle joints. Now, with this individual, his hips were decently strong and his ankles were decently mobile. So the issue here was more so his technique. So having him do the lunge in front of a mirror, he was able to partially correct that deviation, and then he had improvement in symptoms. Now, if you do have weakness of the hip, what you want to focus on is the gluteus medius muscle. This will help keep the knee out when doing any sort of lunge or squat. A good way to strengthen this is with what's called a lateral band walk, where you place a band around your legs or your feet and then you walk sideways. You should feel a muscle burn in the outside of the glute muscles. And then if you have tightness of the ankle, you will also see that same deviation where the knee will go in because the ankle is trying to compensate for lack of mobility. If this is the case, a good way to improve that is to go to a stair, put all of your weight on that foot, drop the heel down, and then bend the knee. You will feel this either in the calf itself or you'll feel it in the ankle joint. Now, obviously, if you do have a strength deficit in the hip or a mobility deficit in the ankle, it takes a long time to fix that. So if you try these and it doesn't fix it immediately, give it several more weeks to months and then try the lunge again. If it is just a technique issue, try and focus on keeping the knee out. Imagine a vertical line from the top of the foot going straight up. If your knee is to the inside of that line, then you are placing the knee in a compromised position. So the knee should be slightly outside that line if you want proper anatomical alignment, and this will allow the kneecap to slide up and down as opposed to being pulled at a curved angle if the knee were in.